food allergens, insect stings, or exposure to latex. These are all potential triggers of a life-threatening event in your workplace. And being unprepared is just not an option. That's why in 2012, we opened the discussion on anaphylaxis and what it means for your workplace. Hello, I'm Barry Eisenberg, Executive Director of the American College of Occupational and Environmental Medicine, and welcome to the second installment in our ongoing series about managing anaphylaxis in the workplace. During our first program, we touched on how you could raise greater awareness among your employees, take steps to avoid accidental allergen exposures, and respond in emergency situations. In this installment, we're going to dig deeper into some of the regulations and guidelines that organizations face when implementing a company-wide first aid policy that addresses anaphylaxis. But before we begin, if you are joining us for the first time, you can view all of the previous programs on demand at ACOEM.org. And feel free to email us any questions you have along the way. If you do, we will get back to you promptly with answers from our guests or from the ACOEM team. Joining me today is National Safety Council Master Trainer Barbara Caracci. Barbara, welcome back to the program. It's nice to see you again.
Thank you, Barry.
Let's recap a bit here. What is anaphylaxis?
Anaphylaxis is a severe allergic reaction that can be life-threatening.
Barbara, what are some of the common incidents in a workplace that might cause an allergic reaction?
Oh, there are many. Foods, for example, like tree nuts or peanuts or shellfish that an employee might find in a vending machine or even on another employee's desk. Substances such as latex or bee stings, yellow jacket stings. If the employee works in a healthcare facility, certain drugs could also trigger an anaphylactic reaction, such as penicillin.
Barbara, you've had a lot of experience at the National Safety Council in learning about and teaching about employee health and safety regulations. Could you share with us some of your insights on employers' responsibility in first aid and emergency preparedness in the workplace?
Yes, I'd love to. The responsibility for first aid training and for response in the workplace falls square on the shoulders of the employer, and that comes from OSHA through regulation and through OSHA standard letters of interpretation. And there are a number of regulations. The one that most commonly is addressed is the Medical Services and First Aid Regulation, which is 1910.151, if anybody wants to look that up. And basically that says that the employer has to assure that there is medical assistance available for consultation on matters of employee and plant health. But in the absence of an infirmary or a clinic or a hospital that is within near proximity to the workplace, then the employer has to be responsible for making sure that there is first aid training, first aid trained employees available, and that those employees have an adequately equipped first aid kit. So that applies to the majority of the workplaces in the country. There are a few workplaces where the hazards are greater, the risks are greater, the injuries are more severe, where immediate help has to be available. And OSHA addresses those industries such as telecommunications or construction, logging, longshoring. OSHA addresses those in specific regulations on first aid. So the employer is responsible and all employees are held accountable. There was a letter of interpretation that asked about company size relative to having to comply with 1910.151, and in a letter of interpretation, OSHA said that all employees have to have adequate coverage regardless of the job they do and regardless of the size of the company. So you have a lot of responsibility as an employer to make sure that help is within near proximity, and if it is not, that first aid trained people are ready. There's a lot of talk about what near proximity means. And I'd like to address that just for a minute in case some of the people on our audience aren't quite sure. In near proximity, when you have incidents that involve suffocation, amputation, falls from one level to another, or falls from one level to the same level, or electrocution. And you could access that by way of your OSHA 300 logs. When there's a relatively good opportunity for those to occur in the workplace, and where there's a little history of that happening in the workplace, then you have to have first aid trained people unless you are within 4 minutes of definitive health care. In office settings where the risk is less than in the other occupations, OSHA says that a 15-minute window of time is what should be considered in near proximity. But here's the rub. In the United States, in cities, in suburbs, the average call to response time, and what I mean by that is 911 call is made and the emergency medical services show up at the patient and start to treat the patient. The average call to response time is about 10.1 minutes. In rural areas, it is 25 to 30 minutes. Now, a lot of employers might say that they could see the ambulance company down the street, or they are clearly an office setting and they don't need to be any more than 15 minutes away. And so they're free and clear. And that's a real false sense of security, because the time that I gave you is in the best of all circumstances. It's when the road condition is great, the traffic isn't congested, the ambulance company in your town is there and waiting. It is not 2 towns down assisting in another emergency. It's when the emergency medical services arrives at your door, the door is open so that they can get the gurney, and the elevator is held so that they don't have to wait. So when any of those variables is less than ideal, your response time stretches to 11, 12, 13, 15, 20 minutes. In a situation like anaphylaxis, where it is a life-threatening emergency, that person who's experiencing anaphylaxis doesn't have 10, 12, 15 minutes. They need help immediately. So OSHA is pretty specific about the burden of responsibility relative to care in the workplace.
Barbara, you've told us a lot about OSHA federal regulations. We also know that many states have their own workplace safety regulations. Do those pretty much mirror OSHA regulations, or are there real differences?
Oh, that's a good question. The federal government allows states to have their own OSHA, but the state OSHA, and I believe it's about 22 states that have that now, the state OSHA program has to, at a minimum, comply with the regulations that the federal OSHA has. Now, they can exceed the limits that the federal government sets, but they have to at least comply with what you have federally.
Barbara, thinking about the federal guidelines for emergency aid response, how would those apply to anaphylaxis?
I'm glad you used the word guidelines, because while OSHA mandates that first aid be provided, it has guidelines on what should be included in first aid training. And in 2006, OSHA published its most recent Best Practices Guide to First Aid in the Workplace. And at that time, under the major category of life-threatening emergencies, OSHA said that first aid trained people have to become aware of the signs and symptoms of shock that results from injury or illness, and they have to know the appropriate first aid for shock. Where anaphylaxis fits in here is that it is considered not an injury, but an illness, and a very sudden illness. So anaphylaxis is covered under the best practices guidelines that the training should include.
Barbara, you mentioned training for dealing with anaphylaxis situations. What kind of resources are available for training, and how would people find out about those?
Okay. There are a lot of course providers in the U.S. who have first aid, CPR, and AED training, and the first aid component of that training in all cases has some written information about anaphylaxis. The National Safety Council, however, has recognized how critical time is in responding to an anaphylactic emergency because it is so life-threatening. And as a result, in our courses, we have pulled out anaphylaxis from the chapter on sudden illness and gone beyond just some narrative about it. And we include skills practice and skills testing in use of a training epinephrine autoinjector. And we feel that's very important because we want to build muscle memory. We want to have people have confidence in their ability to respond and not be put off by using an epinephrine autoinjector to help somebody who is in an emergency.
Barbara, let's pick up on that and talk about state laws that might impact the usage of epinephrine autoinjectors. Are those pretty consistent across states, or are there real differences?
Oh, there are real differences. State law varies, and you almost have to go on a state-by-state search to find out what those laws are. But I will tell you that in virtually all states, students are allowed to bring their own epinephrine autoinjector to school in case they have an emergency. There are 2 states, Illinois and Georgia, that have passed legislation which allows the school to have emergency epinephrine autoinjectors available to students who may need them. And there is a movement underway to influence federal legislation which would allow states to have epinephrine autoinjectors in schools for anybody who might need them, whether that be a student, or a teacher or a member of the staff.
Barbara, thinking about employers now who might be interested in implementing an anaphylaxis preparedness program in their own workplace to complement the workplace safety program that they might already have, do you have some general tips for getting started, and what kind of resources would be available?
Okay, tips. I have 3. Educate, train, and work with your community. So educate everybody. Tell everybody in your workplace about anaphylaxis, what it is, how serious it is, what causes it, and what to do if somebody has an anaphylactic emergency. And that should be fairly simple for an employer to do through a company newsletter or a lunchbox safety talk or a all-employee meeting. Train a first aid team and drill that team so that they continue to have confidence in their ability to respond to life-threatening emergencies. Hopefully your training materials will include skills practice and skills testing in the use of a training epinephrine autoinjector. And then last, work with the resources in your community, your local emergency medical services. Tell them that you are interested in knowing, do they have epinephrine autoinjectors on the ambulances that may respond to an emergency, and let them know about who's trained in your company to provide first aid in an emergency. In terms of resources moving forward, I hope that ACOEM members and National Safety Council members will contact the National Safety Council. I will be happy personally to help answer any questions or assist them with their efforts to set up first aid training programs.
Barbara, I think you'll have many ACOEM members taking you up on your kind offer. But thank you again for joining with us and for sharing your unique insights on such an important topic, one that can really impact every ACOEM member and National Safety Council member. Before we go, if you are joining us for the first time, you can view this program again and all the previous episodes at acoem.org/anaphylaxis. And feel free to email us any questions you have along the way, and we will get back to you with answers from Barbara or from the ACOEM team. Be sure to join us next time, when our guest will be Walt Disney Parks and Resorts Chief Medical Officer, Dr. Pam Heimel, who will discuss the employer experience. Until then, thanks for watching.